Good evening, Commissioner Hawkins. Good to see you.
Good
Um,
evening. I apologize for being late.
that's all right. Thank you. So this is December 16th. It is now 5:07 according to my clock. And this is the meeting of the Training Subcommittee of the Racial Equity and Policing Commission. My name is Dante James. I'm a facilitator of the subcommittee. And we have, in terms of commissioners here today, Commissioner Hawkins, Commissioner Andrew Weirden, Commissioner Tedeschi, Commissioner Mauga, and from the city is Coletta Lynch. We also have guests, Sergeant Stuck from Salt Lake City PD, and Ms. Jessica Walters, who is the social work director for PD's mental health and substance abuse unit. And also welcome to community members and guests. Appreciate your participation here today. And we will give you an opportunity to engage as much as you like. Well, maybe not as much as you like, but we'll give you an opportunity to engage. So just getting started. Want to also acknowledge this is the last meeting of the year for the subcommittee and or the full commission. And there'll be a break for the next 2 weeks, and then we will come back for the first meeting of the year, which will be on January 6th for the full commission meeting. And then the next subcommittee meeting will be January 20th. There'll be a listening session on January 13th in the evening at the time of the typical commission meeting. There'll be a community listening session. The mayor and the chief will be present, but don't have any particular role except to hear from community members. So that's kind of the upcoming schedule. January 6th is the first full commission meeting. January 13th is a listening session, community listening session, and information will be going out more broadly. And then January 20th will be the first subcommittee meeting, returning this subcommittee to its work. So just in terms of the last meeting, hopefully everyone received the information that Ms. Lynch sent out with lots of Salt Lake City's responses to requests for information, but also the minutes from the last meeting. So just want to see if there were any updates or corrections or additions to the meeting minutes from December 9th. Okay. So apparently those are good. So we will call those good. Commissioner Tedeschi, any report from the youth committee that's relevant to the training subcommittee?
Yeah, so last Saturday I got to meet with the youth subcommittee. We didn't get to meet the week before, like as a whole committee, so I didn't get to share to them what we talked about with Chief Brown. And so I talked to them about how when Chief Brown was here, I asked him about what it would look like for the police department to move to a more specialized training, like to incorporate specialized training. So I believe what Chief Brown said was that it would just be hard with the time and the resources that the police department currently has. But I was just wondering, like with the rest of the youth subcommittee, if we could look into what it would look like to make that possible. Like, is it the budget that's not working out? Is it just the time, like it would take too long and it would just be too hard to make more specialized training for the police department? So we just had specific questions on why we can't make that happen, because we do think that providing more specialized training and having police officers that can respond to specific calls could be potentially life-saving, like with police officers being put in a position where they might not have gotten enough specific training on a certain call, and they might make an impulsive decision that could leave someone injured. So I think this is something that we should look into more and maybe not push it off just yet. So that's just what we wanted to look into more.
Very good. Thank you, Commissioner. And maybe just in terms of some helpful information, the information that we received from Salt Lake City's PD, I think yesterday or maybe the day before, included, or I guess I would call your attention to a document prepared by Captain Morgus, head of the training division. And he outlines very specifically some of his thoughts on the need for additional funding for the training division and what he would like to see be able to happen with that money. But I think he outlines very well, at least his wish list, if you will, for additional funding for the training division and what some of those needs are very specifically. So it might just be helpful in the deliberations of the youth commission and the committee and the youth commission members as they think about this process. And we're certainly going to talk some more about that in budgeting. And our next guests are going to be, I think, also having conversations around the budget for CIT training and other things like that. So I think will inform that conversation that you all are having, which is great. So that just takes us right into our guests. I wanted to be respectful of their time and get them in and out if they wanted to be able to do some other things with the rest of their evening. But with us are Sergeant Scott Stuck, who's head of the CIT unit, if I believe that's correct, Sergeant. And then Jessica Waters, who is the social work director for Department of Mental Health and Substance Abuse Unit. And they're here to talk about CIT and the questions, a lot of the questions that we had and submitted to the police department. They also have provided a written response, but I think that some of the engagement we can have or questions you might be able to answer might even be more in depth based on the conversation that I actually had a chance to have with them yesterday. And it was enlightening to say the least in terms of some of the budget and some of the training and other things. And so I certainly appreciate their participation being here today. Also, I want to acknowledge and welcome Lieutenant Zayas, who's here, and also Commissioner Smith, welcome this evening. So I will turn it over to Sergeant Stuck and Sergeant Waters. I'm going to promote you maybe, or maybe demote you, depends. But Ms. Waters, just to give some broad thoughts on CIT, they received the questions that we had, and then I think I could also certainly supplement based on our conversation if necessary, but want to just open it up for questions from each of you as well. So I will just turn it over to Sergeant and Ms. Waters.
I'll let her go first because she's technically the boss.
Yeah, I don't know if it'll be helpful if we just go through kind of the list of questions, but yes, our social workers are paired with our CIT officers who we have our own unit who does train Salt Lake City's police department, and Sergeant Stuck specializes more in the CIT realm of the actual training and the outline of all of that. But I just touch briefly so everyone is familiar with what we do. We have social workers who respond to mental health calls with the officers who are in our CIT unit. And right now we have 4 officers, 2 are on medical leave right now. And these are the positions we've been allotted to have as detective positions that strictly specialize in this. So we could have more, but at this time we aren't technically allotted more detective positions. And so we have a social worker and a CIT detective who respond to social issue calls through 911, whether that is suicide, mental health, substance use, homelessness, an unwanted person, any of those calls that are pretty common for social to be involved. And so our team partners together to try and figure out longer term solutions. And then also we are first responders on scene with those CIT detectives. So just kind of a brief overview of what our unit does in the police department. Unfortunately, we're only day shift right now, 6 a.m. to 4 p.m. That is definitely a barrier. We would love to be afternoon shift. And for the needs, we have like a chart that shows the needs of mental health calls in the city, and day shift and afternoon shift are the highest need. Graveyard shift, not as much surprisingly, but we don't have enough staffing to be in the afternoon shift yet. And so with the day shift, we're able to meet more needs to be able to connect people to resources versus at 8 o'clock at night, I can't go and get someone their medications. So just a little quick overview about us, and then I'll pass it over to Sergeant Stack to kind of focus more on the CIT side.
I wanted to ask Jessica, Jessica, is it budget that limits the times that you cover, or is it something else?
I would say staffing. So yeah, budget of having more. We have 8 social workers and 4 detectives. If we had at least 8 detectives, then it'd make it easier to spread out to more shifts. So yeah, budget and staffing kind of hand in hand there.
And also, as I understand it, Reverend, it's capped at 4 officers currently, is that correct? Yeah,
That's
so there's a cap on the number of officers who can be in the specialty unit of the CIT trained officer.
And to clarify, it's not 4 officers that are CIT certified or CIT trained. It's just that we have 4 that do the follow-up to mental health calls.
Thank you.
I'll just give you guys a quick overview of our CIT program. So we started between 1998 and 2001. We started putting together the CIT program. And when I say we, it's 2 people, not including me. I wasn't working there back then. So at about 2001, we held our first CIT Academy and ran those 1 to 2 a year going forward. In 2006, the Division of Substance Abuse and Mental Health came out with a grant that Salt Lake City applied for through an RFP process. And in doing so, we're awarded the state CIT Utah program. So what we did was we had 2 officers that went around the state and facilitated other agencies putting their CIT programs together. It was part of organizing regional coordinators. So for example, Cedar City would have their own regional coordinator that would put the CIT training together for that area. And then the 2 officers would go down when there was an academy being held. They'd go down there and they'd actually sit through the final 2 days or help run the final 2 days just to make sure everything was going smoothly. They'd provide whatever necessary resources. And at the time, they were charging $75, I think. And I think that's still what CIT Utah does, $75 an academy. And that money would go back into that training. In 2016, one of our officers that had been in our CIT program, who was retiring, wrote a competing RFP and was awarded the CIT grant from the state. So he created a nonprofit called CIT Utah Inc., which is the one that Sherry Whitward now represents. And so they created their program to facilitate all the money. They still wanted to charge, which we kind of figured out along the way that we weren't charging our own agency when we were running the CIT program. So to run X number of officers through that training, we had to have enough seats in the class and we had to have enough funding from the department to pay to do that. And since we'd been doing the training for 10 years, we saw no reason to continue or to start paying someone else to do that. And it wasn't just us, other agencies, including West Valley. We have Orem City works with us now. Unified Police, Salt Lake County Corrections, and Sandy City all participate in CIT Metro, which is what our program is. So we found that we could all, since we had all the relationships in the community here, and we had connections with all the social work programs at the university, et cetera, we would have all those in place already. There was really no need for us to pay CIT Utah money when we were already doing the academy. And that's really what would happen is we would pay them, but we would still be doing it ourselves. So at that time we joined up, and since 2016, CIT Metro has been running our own academies in Salt Lake County and Utah County.
Thank you. Maybe if I can, I'm going to interrupt. Is there more you'd like to offer based on the questions that we asked, or I can kind of fill in from our conversation yesterday and let it go from there? I'll follow you lead.
Yeah, well, I mean, and I have the questions that you guys had submitted, and then today have been working on the second set from last week's meeting. So I could probably talk your ear off unless there's a specific you guys want to talk. I mean, I can tell you just right in front of me, I have our because I didn't have it for you yesterday when you'd asked, but I know you guys were asking how many trained CIT officers we had. And I went through and double checked that and verified everything. So we have 189 officers that meet the criteria of voluntary recertification. So they've kept it from the time they went through the academy and continued on. And we have 272 that have been CIT trained but chose not to continue. So that's for a total, I think, and my math could be wrong. They say not to do math when you're on the radio. This is kind of the same thing. So 461 is the number that I did earlier. I think we have 550 to 570 officers on the department, including the airport. So, and the majority of the airport officers were not part of Salt Lake until about a year and a half, 2 years ago, something like that. So they really never participated in CIT, which means those numbers are actually really, really good to considering we just added their entire agency.
So that, yeah, and I'm not the one to do math. So that leaves about 100 or so officers unaccounted for?
Yeah, approximately. Some of those are senior officers that never went through it because they were working here before the program was instituted. Some of those, like I said, are airport officers. And then we do have a percentage that are lateral officers as well.
Okay. And just from the information you shared in your document as well as yesterday, there's about 10 to 15 laterals per year for the last several years anyway, I think was the number I got, right?
Yeah, and I got the exact number from the training sergeant. The number for the last 3 years, the total number of lateral officers is 35.
Okay. Okay, thank you. And then maybe if you could talk about the budget, because that was the most, maybe one of the most eye-opening pieces for me in the conversation yesterday in terms of the budget that's allocated for CIT, for training, for expenses, for things like that.
Sure.
What that actually looks like.
Okay, so currently we have about, I'd have to double check, between $4,000 and $5,000 left from when we ran the CIT Utah grant. So we use that money to replace resources that we have, but really all of the stuff that we do with our CIT program is we've adapted everything so we don't have a budget because we weren't given a budget for it. So for example, we had to change from paper documents to we'll just email everyone a file, or we print a smaller document. Instead of having the entire training manual, it used to be a binder, like an 1.5 inch, 2 inch binder. And now we've whittled it down to, I think the last was about 40 pages, and we have resources and everything that are listed in there. And we just email that out to the candidates in the class now. So we don't really, the maximum we do is if we're printing documents specifically for the class. And then the only expenditure that we've had in the last 3 years that I've actually had to pay out of pocket for, and I say pocket, but it's out of the grant money that we have left over, is for twice a year we do in the academies. We run twice a year, so we're doing consumer lunch, which is where we bring in their peer support from the MCOT teams. So that they work from the University of Utah. They're individuals that have in the past suffered from some version of crisis. And so they might be on medication. There's a great gentleman that I met that he'd suffered from bipolar and had a very psychotic episode. And so he comes out and he talks to the officers about it, but they'll sit down and they'll have lunch because what we found was, and this is nationally, I think is what they do for CIT. But what they found was it's harder to get people to engage in that awkward position where you're put in front of a stranger. But when everyone's eating together, suddenly it's magical and conversation really picks up.
Uh-huh.
So that's the only expansion. That's about $400 to $500 that we spend a year.
Okay. And so there's no actual specific line item for training in your budget, correct?
Correct. And anything we do, we sneak it in through the community connections. So Jess's team will sneak it in through them if we can. it has to meet the criteria. So we might request training through their budget.
Okay. And then just for clarification, I guess, one team equals one social worker and one officer on the street. And yesterday and Jessica, today you said eight cops would equal the social workers you have. So that could be 8 teams, but it would take 28 teams to be 24/7 to be able to provide service. Is that what I?
Yeah, that's kind of what we calculated to meet the bare minimum need of the crisis calls and mental health calls in Salt Lake City would be 28 teams to be 24/7. And right now we're at a max of 4 teams at a time because we have 4 detectives.
Okay, thank you. So I'll just pause and commissioners, questions for Sergeant Stuck or Ms. Waters?
With such a drastic shortage, what are you doing now when those calls come in? And how do you know whether those calls are fit the criteria or not? What's the criteria that you use to determine what they are?
Well, when we're fully staffed, and that's just with the 4 officers, we're more expansive on what we'll go out and do. So we might spend more time in homeless encampment, responding to calls that might involve mental health and homelessness. So like a trespasser call or an unwanted person, those are fairly common, and those become harder to handle when we have fewer officers because we might reserve ourselves for that higher priority for like a suicidal individual or for a direct mental health crisis call.
And I think it really depends too, Commissioner, as well, because we have quite a few people who may be what we call a frequent utilizer. And just by the description of the call that comes out, we may be working with them already. And so I think that's important that we try and engage with some people. And sometimes we do go on calls that do have weapons. We do wear ballistic vests and carry pepper spray on the social work side of things. So we try and prioritize any of the suicide mental health calls. In the downtime, we do the follow-up for anyone who's had. Sergeant Stuck runs the CITQ, which is if an officer's been out on a call, they fill out a template about basically what happened, what's going on with their mental health, send it to him. And then we figure out if we need to follow up on that person and see if, do we need to help them get connected to the services to help lower their calls? And so that's also a part of it on the downtime, is following up on those cases that have already happened. Now, 24/7, like he said, we have officers who have gotten recertified voluntarily for CIT. And so we still have officers responding to mental health calls, even if our team is on shift and we have all of our teams ready to go. There's still maybe mental health calls holding and we're busy on a call. And so we still have to have, officers going out on that without some of us social workers too. So I think that's what's important with our officers who are getting recertified voluntarily, that, we're trying to send all those ones out to those mental health calls.
And could you talk about the classification of the calls as you described it? Because they're not all classed as a mental health call when in fact you get there and there's no question in fact that they are. So so the numbers that we get, I think we also receive the data on the number of calls on any given time or day for the last year or so. But maybe you could speak to the actuality of whether those are the real numbers or not.
Yeah, so the call type will be labeled as whatever the complaint is when the person's calling in. So if they're claiming there was a burglary, then it's labeled as a burglary. They might list in the details of the call that the person might be mentally ill. So the officers will respond to those calls, but depending on how the officer clears the call, it may not be documented as a mental health call at all. It may be that they do clear it as mental health. It just depends on what the label is for. So it's called an NCIC code. It's for the FBI tracking stats. So the NCIC code for mental health might not be used if they're not documenting the report. If they're documenting the report, they might add that just so that way it gets routed to me.
Great, thank you. And what I wrote down also yesterday was that nearly 100% of calls dealing with the homeless are in fact mental health related, but that's probably not how they're classed when you get the call. Would that
Right.
be a fair statement? Okay.
Right. And I can speak to that. I did 3 years as the bike sergeant. So that our primary function was patrolling the homeless shelter right around 500 West. And I actually had this conversation with an officer earlier that we never cleared calls or documented anything with mental health because really every single call we were going on had some form of mental health. And I believe that there's some level of mental health concern for all of our homeless individuals. So I think that's why a lot of officers get frustrated, because they don't understand why someone of sound, rational mind would want to live, particularly right now on the street where it's so cold.
Thank you.
And I think too, like with the calls as well, it is important to say that, you know, I may come out as a stalking. The person calls and says they're being stalked. That's not going to be flagged as mental health. But like Sergeant Stuck said, it may say in the description, you know, people have been out on this person 3 times this week. We look into the details and we recognize, you know, they're seeing someone that other people can't see as stalking them. And so we may take that call. And so we try and read into the details. It's really important from the caller, what details come in from the caller that flags for us to pick up on it and be like, okay, if this is a stalking case, let's go out there and hope to help intervene and see how we can help them out. So the calls, I wish there was just like one NCIC code that would pull everything and touch all the points, but definitely in data tracking, it's lacking. So we're missing a lot of mental health related calls to add to those stats, just because it may be a homeless related or stalking or robbery, when all these may actually be a mental health component to it.
Thank you for that.
I have a question.
Yes, please.
So is the training, or is there like a certain team for dealing with calls with minors, or is that just grouped under whatever incident it might be?
If it's school related, then we have the school resource officers. But no, in general, there's not one squad that would be assigned to children.
But we have worked on, like we've went out on quite a few children ones or juvenile ones, just based off of the facts of, you know, like repetitively running away from school, or, you know, kind of noticing a trend. So we do go out, but we're not specifically like flagged for us to go out. But that's a great question.
Do you think that would be helpful?
Would to have a juvenile squad, or is that what you're asking?
Yeah, or maybe training or something like that specific for it.
Yeah, I think the training definitely. We don't have a lot of juvenile specific training, but I don't know. I know our gang unit works a lot with juveniles. Their school resource work a lot with juveniles. I don't know. I don't know what their primary task would be. It would take some time to put that together.
And I'm not sure if you guys are familiar too that there was a grant recently approved. Ashley Fletcher, have you guys met her already? Then she's she's full time, but they're trying to hire part-time social workers in the school system with the school resource officers to try and help focus on, you know, gang activity or school stuff. But that doesn't necessarily mean that they're going to be dispatched in the community. That's mainly more school related. And then on the back end, we may follow up with someone who, you know, a kid's not going to school, what's going on, you know, there may be some issue, you know, some concerns of their home life, then maybe someone will send us an email, say, can you check up on this? Or sometimes the school reaches out directly, either to us or Ashley's team. And what is that called? Promising Youth program that they had for this year to get more social workers.
Well, if y'all want to know how an adolescent acts, you could just come see my behavior and it'll give you some pretty good tantrums and all that good stuff. Ain't that right, Steve?
I can verify that, yeah. Hey, I have a couple questions. I'm still trying to wrap my head around what I'll just call a program totality. So you're selected in responding to in progress calls. That's determined on information gathered by the dispatcher and perhaps the history with that subject.
Yeah.
So just one placeholder for that. Do the dispatchers get included in some sort of training to gather that information to create that trigger so you get the right folks at the right place? And then I heard you say to carry a queue, your detectives carry a queue, and that's routed based on the NCIC code. So can that be a secondary code if they also recognize it? And with the 100 officers who are don't have a foundation in the training in to say MCERT, but I'm trying to remember the
CIT
term for the mental health training. If those folks also were included in that, do you think you could be more accurate in capturing more of the indicators on that call? So in other words, if they had the training, could they identify it? Then what do your officers do with that cue? Like what kind of follow-up do they do with those individuals? And then finally, what is the relationship with MCOTS? Does that exist? I can repeat those if you need them, but a lot of information.
Yeah. You'll probably have to repeat them. But as far as the queue itself, what happens is officer writes a report, identifies that there's a mental health concern with the individual, gets routed to me. I'll read through the case. I'll see what prior history there is with the individual. I'll actually check to see if that person has already had any engagement with one of my officers. And then from there, depending on what the crisis was and how many they've had, will be determined if we'll assign an officer, if we'll ask the social worker to make that phone call. But what they'll do, and it depends on the person, it depends on how many incidents there are. I could use an example. We have one individual that has been a habitual 911 caller for us and always wants to go to the hospital. And then she gets to the hospital and then she doesn't want to stay there, or she doesn't want to do anything by their rules. So she'll get released and then she'll call 911 again because she's suicidal. So what we have our officer do is he contacts her about once a week, talks to her for whatever amount of time it requires, just to make sure she's doing okay. He's built that relationship where she calls him, or she'll leave a voicemail for him if she's having any troubles rather than calling 911. So he's helped her build that relationship with himself, and then kind of trust some of the other service providers that she can reach out to so that she's not abusing our 911 resources.
In terms of return on investment, have you guys calculated how many dispatch cases didn't have to occur because you're able to have that relationship? I mean, it's big picture too.
Yeah, so we did one in 2016, and we're actually, in fact, as of yesterday, we discussed using 2 different individuals to follow through. There's a lot of information and a lot of resources we have to reach out to get that information, but we're going to try to see how it's working with those 2, and then see if we can build upon that, depending on how long and how much effort it takes to do that.
We would love though to have like a great picture of that. Like that'd be our goal in data collection, to say we saved this much money. We also prevented this many hospital visits, 911. The one person I think we had predicted we saved $800,000 on one person because of how many ER 911 ambulance things. So it's just hard to predict their future, but yeah, we're looking at a few cases to do the breakdown and try and give a prediction and see like what's happened in the past time that we have worked with them.
My other question is a reminder, were dispatchers in the loop, that information gathering to make sure that it is after the caller says it, it gets documented. And then secondly, as your officers close out their cases and they classify them with their NCIC codes, if they had a better foundation, mental health understanding, would that help you capture more of those cases?
Yeah, I think the training builds because our two primary goals with CIT training are to build empathy and understanding with the mental health community that we serve. So the idea is that if we're responding to these calls and we have that better understanding, and we're not just trying to check a box and get on to the next call, that the officer will take that extra time and write the report on that case, including conversation they had or whatever's necessary from that for us to be able to understand what they need to do. In fact, it could be something even small. Like today I saw an officer wrote a report, and when I checked the person's prior history, there was 0 cases on the individual. So I thought, and I checked that first. So my thought was, okay, it's probably a minor thing. Get their services from the hospital, and we don't need to follow up with that immediately. And then I look at the case, and he's documented about 8 different calls through dispatch where this subject had complaints about something that were unfounded, but the officers on the prior calls didn't have that same effort to take that next step and document that. So I looked at that and was like, okay, this is something that we want to follow up on. So that's where I think that gap falls with officers that aren't trained, is I don't think that they're taking that extra step. And as far as dispatchers, you'd have to ask them what specific training they have for them. Because I've been involved with them a little bit. We invite them to our CIT academies, but again, they have their own staffing issues to be able to make that happen. So occasionally we'll get 1 or 2 that'll be able to attend. So we've had in several years. I know that we've had some, but it's not as common or frequent as probably ideally.
And then the relationship with MCOT and classification of the call unwanted person come up a number of times. I wonder if the commissioners know what kind of a call that is. Maybe you could define how something would come in as an unwanted person.
Yeah, we actually have a really good working relationship with MCOT. In fact, at the CIT Academy, some of their therapists teach the mental health portions of the diagnoses and things like that at the beginning for the first couple days. They participate in the scenarios that we run on the 4th day, and then our unit specifically works with them in the field too. We've had them call us and say, hey, can you come out? We want to get a second opinion or just get a different perspective to talk to this individual. And we've called them, same thing. Hey, this is what we have. What information do you have, or what are you doing with this individual? They come out and they've already built a relationship, so we can have them take over that incident.
I think that just that dispatch piece, maybe we can make a note of that. It's Suarez generally brings that up, but I think we've seen a number of areas that make some more connections with dispatching.
Yeah.
Thank you. And just for clarification, the CIT Academy is not a standalone. That's the 1 week inside the academy training, correct?
Yeah.
Okay. And then if you could just describe the recertification process, what that entails, and how officers go through it.
So to recertify, the requirement is 4 hours every 2 years, and it just has to be mental health related. So a couple of years ago, Orem City hosted a autism training. And they had an individual come in from out of state. They provided it for free. We sent it out to our department to let anybody know if they wanted to attend, they could do that, and it would account for CIT hours. We have a list of training videos on the website that we use that officers can use to pick up some extra hours for training. They're all, again, very specifically related to mental health. Because Salt Lake City is part of CALIA, that also requires some mental health training every year. So officers can include that as CIT training as well. Really, if they're on top of it, because our officers have to input their own training time. If they do that, then they really would never expire from their certification. They can also attend the CIT Academy. They can go for any 4-hour block. We actually ask that they help out with scenarios, because experienced officers that are in patrol, for example, can provide a lot of good insight on the scenarios, both during and after. It's just harder to get that because we don't offer overtime. When we had the grant, we were able to offer overtime, but we don't have that ability anymore.
Thank you.
I'm a little bit confused about whether there's a need for CIT officers or not. If all of the cases are going to be cleared as criminal cases, then why put forth the effort to do any CIT work at all?
Well, we're not clearing cases as criminal cases. We're just, as a police department, we get called when people need help. And quite often that's because there's a mental health component. And it doesn't even have to be my unit that responds to it. We have a victim advocates unit that is the one that will, they'll be there for any requests from like a domestic violence incident or a sexual assault, or even just a regular assault case. They're available to help the victims in those cases, and that is a mental health component. What our unit does is by having the training and the experience that we have, we can take individuals where a patrol officer that doesn't have the additional training or experience that like our unit has, really only has 3 options. You can arrest somebody if they've committed a crime. You can involuntarily commit them to the hospital if they've committed a crime and they have a mental health concern that is making them a danger to themselves or others. And the third option is to, if they're safe to leave them in place. That might even be calling MCOT, who can sit down with the individual, take the extra time that we just aren't able to afford that. What our unit can do is we can take that next step. Instead of taking someone to jail or pink sheeting them, which is the involuntary commitment, we quite often can find that next step for them. So maybe that person is supposed to be getting into a housing facility or long-term care or something like that, that we can get them connected back into that pathway rather than just sending them to the hospital where we now lose that contact.
So it's not mandatory to recertify for CIT, is that correct?
Correct.
And is it because the 4 hours you mentioned, there's not enough in the budget to pay 4 hours every 2 years? Is that?
No, officers can do it on their own time during their shift if they wanted to. Part of that, and I think this meets what Sherry Whitwer was saying last week. She really stresses the voluntary component. She believes that it should be voluntary up front. We believe they should be trained and then voluntary to recert. It would ideally everyone stay certified and have that continuing education, because just like with everything else, mental health comes out with new information. We get better research, better ideas of how to interact with people, things like that. But yeah, currently it is just a voluntary basis to continue.
Are there plans to change that in the future?
That's not something that I'm aware of. I'm sure it's being discussed.
There's definitely discussions about doing more trainings on the mental health side of things, but not necessarily like a mandatory, and at least from what I'm aware of.
Hey, Sherry, were you going to say something?
Yep. Ms. Whitwer?
Yeah, if you don't mind, if I could just clarify a couple of points. One of the questions I've always had as to why Salt Lake City has done their own training is because from the very beginning, when this training was brought to Utah, and Salt Lake City PD generously had staff administer the program for a statewide program, this program was subsidized through the State Division of Substance Abuse and Mental Health in their federal block grant. It's always been paid for by that. Since that time, they used block grant funds, and some of us as advocates went up to the Hill and got money, legislative funds to subsidize CIT. So by having Salt Lake City do their own training, Salt Lake City PD is having to shoulder the full cost, whereas the state helps to subsidize that. $75 is the academy fee, and that goes for a week-long 40-hour training. That does not begin to cover the cost of per training per officer for a week. So that's just an academy fee to reserve their slot, to have some buy-in, and to make sure people don't back out at the last minute, that type of thing. But the costs are subsidized by the state. So that's the first point. This is not a money-making effort. This is a nonprofit that has taken that piece on. The other part that happens is the administration of the program. So officers get all the materials, every agency that's involved gets the materials and the administration of the program, tracking the training, tracking the time when it's time to recertify. That's part of CIT Utah. That's a service that is given to different agencies. So that's the other piece. It is just an add-on to the budget. It's state funds, legislative funds that frankly Salt Lake City is leaving on the table that would go to our capital city that needs it. So in addition to other areas, but clearly that it's a priority. The other thing is to take out and form isolated teams is extremely cost prohibitive, and it's not best practice. It's not how it's intended to be. What makes CIT budget friendly is that CIT officers are patrol officers. So they're trained, they have the training, but they're on patrol and they respond to mental health calls. It's not a specialized team. And that, I mean, they have specialized training, but it's not 4 officers that work from 6 to 4. There are officers who are on duty all day long on different shifts. So that's the other part that makes it doable, that does not make it cost prohibitive, that makes it something that agencies can participate in. The other thing is there is a CIT for Utah or CIT for youth curriculum that can be used if that's something that's a priority. And there have also been, in the past, there was a specialized dispatcher training that was part of CIT, the CIT training, but clearly there are specialized issues for dispatchers. So those are all things that are sitting there that we can do and that should be done and can be done. So I just wanted to clarify that.
Thank you, Ms. Whitwer. And I'm sure we can get into back and forth about that all day. I'd rather not do that at the moment. I know Sergeant Stuck has to go at 6, so I had one question for him, then whatever else the commissioners may have. And this probably is a better question for Ms. Waters, but in terms of the mental health calls that you are engaged with and the homeless population in Salt Lake City that you deal with, do you have any general idea of what the demographics are, racial demographics of them?
I do not, but that is something that can be pulled from the Utah Homeless Management Information System, HMIS, which is a statewide program. So like with outreach, we document in this system as social workers, but I don't have that data on me, but the state runs that program that could pull that data.
And is that data entered somewhere when you're on a call after, or when you're done with the call?
Yeah, so on our social work side of things, we enter that in the demographics into that Utah Homeless Management System, and that's separate from the police department, and then that can be pulled, statewide, and then city, narrowed down into certain teams.
Yeah. So the best way to access that information would be through what?
Through Department of Workforce Services. Department of Workforce Services, Utah Homeless Management Information System. I could get a contact for you guys or see if I can try and find a way to pull that.
There's no city agency that works specifically with the homeless population? That might
There
know?
is, Michelle Hoon. Sorry.
No, I just said they might know, as opposed to trying to go through the state, which I'm sure would be a little overwhelming.
I would say there's not like a direct person who works in that system with the city. It's more like county, state, and then service providers, nonprofit agencies that are all tied into it.
Do we not, and sorry, correct me if I'm wrong, I thought we still had a homeless services coordinator.
We do, Michelle Hoon. Is that what you're talking about?
Yeah, okay.
But I don't believe she has access to the data system. I think she has to request it from the state to get that. Michelle Hoon at the city with the Heart and Hand program.
So, Ms. Waters, would this include the LGBTQ community also?
Yes, it would. I will say though, that information is not often tracked. So that would definitely be I think that would definitely be missing, a gap would be missing there for sure. Because the state gives requirements for what information needs to be tracked, and demographics is one of those. But that's like the bare minimum that you have to track for outreach purposes out at camps. So it would be missing. It is tracked, but it would definitely be missing in the outreach component. In the shelter, they may have more data from that, but still lagging because it's not a mandatory thing to be tracking, although it would be very helpful and useful.
Yes, that would be. Okay. Thanks.
So my question, even the best way to ask it, but a few years ago I was working with, professionally with a therapist who is a specific calendar, and sharing with me frustrations members of his community had with work order therapy that mostly went to therapists, and the kids felt like they were not, therapists didn't really understand, right? So, and I don't, that's way above, way outside of my education area, but is there elements of factoring in cultural and race issues in your approach, either in CIT or in Salt Lake City's approach, meeting the mental health need?
Good question. I don't know if it's just my internet, but you were skipping out a little bit. But I believe you're asking, is there basically further ways or tactics in how we approach different demographics and different communities? Is that right?
Yeah, I think it was probably better that you couldn't hear me exactly, but you framed it better than I did, so thank you.
Yes.
I agree.
Just to be honest, we don't have I would say we need more training in that, especially Utah in itself. I came from Chicago and St. Louis area, and we had better trainings on that. But I feel like that's an area we could improve on and figure out better ways to do it. Most of it has just been based off of our own education, but that doesn't apply to everyone on the team. Like you did, I think you did mention we do have therapists on the team, so people with master's degrees, and then we try and do different, just in our squad, our co-response team, we try and do our own types of education, different book clubs and reevaluating how we approach stuff. But that's more of our own in-house, but I think that would be a good component to work on.
Thank you.
Jessica, where are y'all housed?
Yes, great question. Currently, we are housed on 5th West and 2nd Street where the Rio Grande, where the road home used to be at. Our rent was just tripled recently, so we're looking at possibly moving over to the public safety building. That's all still kind of pending right now.
Is there room there for y'all?
I hope so. I hear there may be just enough, but yeah, I guess we're gonna see. But yeah, we just can't afford to keep up with the rent down there. And frankly, I feel like it's a bit much of rent for us to pay anyways, if we are out in the streets too.
So gentrification is getting you guys too, huh?
Yeah.
So you guys don't have, it seems like either hardly no budget or very tight. And so now you don't have also a building. And my understanding is training itself, they don't have a building in itself to give top-notch training like a city of our size should.
Mhm.
So it seems like money is a kind of an issue to be able to provide that type of training.
Yeah, and I think it's important. Who pays our rent is actually the Heart and Hand team in the city. So the police they don't even pay that. So we've had to get funds from the Heart and Hand program who pays for our rent and utilities. So yeah, we're finding friends who help us a little bit, you know. But yeah, I do think that's important with the training.
Thank you.
So I want to be respectful of our guests' time. I know Sergeant Stuck had a hard stop at 6, and Ms. Waters as well. So I thank you for your time and engagement in answering the questions, and appreciate you putting together your response in writing, which the commissioners can go back and take a look at. As much of this information I think was also in there, but we truly appreciate your time, and may in fact, as always, have some more questions for you. So if you're good with that, thank you for your time, and you can feel free to stay on, or I know you had to drop off, so thank you.
Yeah, appreciate it. Thanks for hearing us out, and I look forward to talking to you guys some more.
Thank you.
And nice to see you too, Sherry.
Dante, Chief Brown has joined us as well.
Yes, sir. I saw that. Thank you. Welcome, Chief. Good to see you. Also, David Litbeck, good to see you, sir. So moving into the next piece of the agenda, which was just a discussion of the data we recently received either yesterday or the day before from Salt Lake, from the, I think, request from a couple of weeks ago. One, thanks to Chief and others who put all of this together, because it's a lot of information, and I'm guessing most of you didn't have a chance to delve into a lot of it. So we'll really pick it up, I think, at the next session. But I did anyway, into most of it. So just wanted to, some of the data that I put together based on the information received. We had asked about the field training officers and what the demographics of those were. We most recently asked about the demographics of those who are in the training division, and that was the most recent request, and we don't have that yet. But in terms of the FTOs, it was provided with no context, so maybe Lieutenant or Chief can offer some context to it. It was entitled the reception report, so I'm not sure what that means, but there were a total of 67 names on this list. I don't know if what time frame that covers for these 67 officers, but of the 67 officers, 2 were female, 2 were Hawaiian or Pacific Islander, and 4 were Latino. So that's the demographic numbers that we received back from Salt Lake City PD. Chief or Lieutenant, just out of the 67, any guesstimate on what time frame that covers?
You know, Dante, I saw the report come back, and I didn't have time to ask any further questions myself. Those are things that we can look at, and I don't know the time frame. I apologize.
Okay.
Sorry.
No, thanks.
Are those the trainers, or are those the new recruits that are coming in?
Those
couldn't understand that.
Those are the FTOs. That's the list of FTOs. So one more time, there are 67 names on the list. Of those 67, 2 are female, 2 are Hawaiian or Pacific Islander, and 4 are Latino. And then the total demographics of the police department were once again shared. I knew we had them before and I couldn't find them at the last meeting, but I pulled them up and just doing my own math, and don't trust me on math. But of the airport, there are 49 officers at the airport. 15 are people of color, which is 30%. In the, open up. In the emergency management, there are 6 people and 1 is a person of color. In admin and support, which I'm not sure what all that covers, there are 256 people and 33 or 13% are people of color. Of the operations division, there are 310 people, 45 or 15% are people of color. And in the chief's office, and I'm guessing this was before Lieutenant Zayas got there, there are 23 people and 1 person is a person of color. So it's 4% in the chief's office. So the total number of people of color in the entire department out of the 644 sworn officers that I believe was on this list is 15%. 95 people, which equals 15% of the total number of sworn officers are officers of color.
Hey, Dante, just real quick, we don't have 600 and we only have about 571 FTEs. So I'm assuming this may have been an HR report and there might be some civilian staff included in that. I would have to look at that further, but we don't have that number of sworn officers. So I apologize. That may be erroneous information right now. I'm not saying it's not correct, but I don't know what's included in that.
Gotcha.
So
it was just entitled EEO information, so it may include non-sworn as well. So.
Because most of that information comes from HR. They track race and demographics.
Right.
Okay.
Chief, and those are your FTEs, not those are your allocations, not what you have filled now, right? So the total number of officers working is actually lower.
Yeah. Our sworn right now is probably around 500, something like that. So.
Okay. And then finally, well, we have received 2 other pieces of information. One was the mental health calls, which were broken down and listed, and I didn't get a chance to look at those and dig into those at all. And the training budget, similarly, there was a lot of information there. I didn't get a chance to dig into that, so you have it. And then Captain Morcus offered I would suggest a very thoughtful and somewhat detailed response to the number of questions that we asked. And I would suggest that probably the most, I don't know about it, it may be not important, but certainly informative component to his response is his very specific descriptions of the lack of dollars that the training division has. And he very clearly identifies and articulates what additional dollars could also provide in the training division. And so I much respect, because he's definitely arguing on behalf of his division and its needs. So I think it's a pretty informative piece of information from the captain of the training division.
Yeah, I agree with that. I did read it, and I agree that his what's called a wish list was important. But I also appreciated a couple of things. One, he gave a lot of detail specific to our questions that sometimes takes us 2 or 3 asks to get mutual understanding with the department of what we're looking for to actually build. So I really appreciated how broad his answers were and how thoughtful he was. And then I also thought it was a good overview of how the officers are evaluated in training and the areas that have coaching and counseling to improve, the areas that require you to go through auxiliary training if you're not successful the first time through. And I know that's been a real question on this committee, how the officers are evaluated, if it's effective. So I encourage all the commissioners to just take a look at that. It's a pretty detailed piece of information and a lot of different categories that they grade differently. And I appreciated that response.
Yep, very true. Much appreciated. So please, Chief, pass on our thanks for his thoughtful and detailed response to the questions. Commissioner Prospero?
Yeah, I just wanted to really push that part that they really focus on that reality-based training. that's best practice in almost anything.
Right.
It's not didactic. We actually have to practice, whether it's with kids in elementary school or treatment centers and substance abuse residential centers. I mean, that reality-based training is just huge, and it seems like there's a huge gap in being able to provide that type of training. So, in the military, we did it all the time. I mean, it was just the norm. You did it practice. After a while, you don't have to think about it. And so if we're not going to have our officers do that, then it's going to be really hard for them to react appropriately out there when the action kicks in.
Very true.
I think too,
Oh, go ahead.
sorry, Dante, with that reality-based training, I think that's another opportunity. You talked about a community partnership and having another set of eyes for bias and making sure that those cultural issues are impregnated into those types of trainings. And I think that's a really good way to have a community relationship in the development of those scenarios. So I think they're effective. And I think it's a good way to get another set of eyes on it through
I will say one thing that caught my attention that I don't know how it would work is that every week that the training bulletin regarding a specific policy is sent out, and then officers are then tested on what the policy would dictate in a particular scenario, and then they're presented with the question until they answer it correctly. So how are you testing 500 officers every week? Just boggles my mind. So I'd really love to hear how that works. It seems like
I wonder, and Zayas could help us with this, but I think it's part of the contract with the policy development company that they also create tests on newly pushed out. So in some ways it's automated, so it's achievable. Chief or LT, I'm off on that. Please help out. But
so what you're talking about is like the daily. It's called it's like a DBT or DTB. I can't remember the exact acronym. And all they do is you read the policy and then they're randomly thrown out there. They just give you practical scenarios that are written down, and then they give you choices that you could select on what the correct answer is. And if you do answer it correctly, it tells you until you can answer it correctly. It's not a reality-based training. It's just a practical application that's written after you read the policy, making sure you understand how to apply that policy in a practical application. With the RBTs, with the reality-based training, what they're trying to do is take the newer policies that we've implemented and put them into a real application and making sure that they understand how you can articulate your actions or make sure you have that better understanding of what the policy really means, is what his goal is with the RBT training. It's just man-intensive in applying and doing scenario-based training. Does that answer your question?
I think it's a policy question with Lexipol.
Yeah, Commissioner Angie Warden, you're right. It's through the contract of Lexipol. That's the policy management company that we contract with. And it's a service that they put out automatic, built into their system.
Okay,
Yeah.
so it's just an online piece.
Yeah, it's just an online. You read the policy. It's a way to track the new policies. That you can put out new policies. You can track who's read them, when they read them, and then there's a testing system too. So.
Okay. Yeah, I just didn't see how you'd have the capacity to do that. I was wondering how you'd have the capacity to do that.
That's been really busy.
Okay, thank you. But again, to everybody's point, if you haven't had a chance to review Captain Morgas's response, I really do find it informative and certainly worthwhile to read and get maybe a bigger picture on how some of that evaluation occurs. And I know several of the commissioners were concerned about how do we ensure that what is trained is also how things are applied and how those outcomes really happen. And so this gives us some insight into that. I'm sure there are more questions that commissioners might have, but I think it begins to give us some insight into that process. Any other thoughts on any of the information that I provided, or certainly if you had a chance to look at any of the documents, any thoughts or questions that might need follow-up or next steps in that regard? Okay. In terms of the next agenda item is continued discussion, just kind of maybe finishing up on the report on 21st century policing, and wanted to, I meant to pull it out, call attention in particular, I believe it was 5.7. Let me see. I know I had spoken to Commissioner Suarez, I think, called my attention to it. Is that the right number, Commissioner? 5.7, yes. As is specifically related to improvement of social interaction and how that might really be a main component of the training and in the academy. And I would suggest in the ongoing in-service sessions as well. Because this is talking about implicit bias, emotional social intelligence, and other things, but really how that social interaction is really designed to happen in the best way. I know I think last week, Commissioner Andrew Reardon even talked about, how are we expecting officers to run from call to call to call, while at the same time improve their interactions with the community, and what that dichotomy is sometimes, and how that creates difficulty and maybe the lack of interaction that can really happen. We just wanted to call your attention to 5.7 that really addresses the need to improve social interactions besides just tactical skills, but that need for social interaction is so important.
And I think if I could augment that, particularly the white officer is interacting with a member of the BIPOC community who may have negative experiences towards law enforcement, even though this individual officer may not have any experience with that at any point. The officer needs to know that it's worth the time to engage with that individual to help create that kind of connection, so you can actually get down to the business of the work at that moment, right? So it's just another reason, and specific to our commission, in my opinion, why that social interaction is so critical and why we need to make time for it.
Thank you. And I would also add, not just how do you socially interact, but how do you know and understand the history of the communities that you are policing? Because the communities have a much longer memory than many of the officers on the street, or the officers on the street may not have any understanding or knowledge of previous interactions between police and community that happened 15 or 20 years ago before they ever joined the force, but the community remembers. And I would suggest that sets up a difficult dynamic quite often, because the community is already going to have its response to an engagement that the police officer may never understand where it's coming from, because they have no understanding of the history of the communities they're policing. And so, at least I haven't seen in the academy anything that speaks to that type of component in training around communities that Salt Lake City is serving to that depth. And maybe I'm wrong. Again, we haven't seen some of the curriculum and its content, but please help me out, Chief or Lieutenant, if I'm incorrect in that. But just my thought in some of the things and interactions I've seen around the country.
Yvette, I'm not sure if you have that built into the training curriculum, but I do know during the FTO program, when the officers interact with a number of seasoned officers from the department, many of them have decades on the department that have that historical knowledge, and that is taught as they work at different areas in the different communities in Salt Lake City. Yvette, is there anything in the curriculum of the academy?
Nothing that's like spelled out like that, but when we do run scenarios, we try to bring in our explorers to help, who are part of our community, in helping our officers understanding what you might encounter. And we also try to bring in the FTOs who are, bring in various experience and who interact with the community, who can kind of portray what they might be dealing with out on the streets. And we've never brought any role players from the community besides the explorers. That's kind of been our biggest connect into the community with interacting with the recruits.
Thank you. Any other thoughts, commissioners, on that particular subject? All right, thank you. I want to offer some time for our community members to ask any questions or make any comments. So I'll just open that up to anyone who'd like to make a comment from the community. Okay, thank you. As we finish up, I thought we could use the last just a couple of minutes to maybe have a brief conversation about where we are, what we've learned, what has really resonated, what do we see as maybe gaps, certainly challenges that we can address. What have we learned at this point, and what do we see as maybe next steps coming back in 2021? Big question, not a lot of time to talk about, I understand, but really would just love to get your sense of where you are in this process and its value to you in its learning and being able to represent your communities in trying to do this work and ensure the best outcomes for your communities when it engages with the police department.
Well, I think one of the things that we've learned is that we have major budget restrictions that control training and the amount and the type of training that people are getting in order to be good and effective officers. And I think that's an area that we need to craft a suggestion about how to improve the training budgetarily.
Thank you. Other thoughts?
I don't always speak up, but I would like to say that I appreciate all the information that we've been able to gather from the police department, and I'm grateful for all of their help. As Commissioner Davis said, I think the budget is a big issue. I mean, because at the end of the day, we want a police department that can work together with our communities. And I don't think we can make that happen unless we really take a good look at the budget and figure out how to make that work together with what our goals are.
Thank you.
And yeah, it appears that, we have a training department or whatever that's motivated, that's, they're there, they got the heart to, hey, let's try as much as we can. It's, try to be as hold our officers accountable as well. It seems like it's there, but for me, I just keep seeing we can't because, the budget, right? Oh, we would love to, but that would require this many more officers out there to do that. And if you want them to understand our community, well, that's going to take more time as well. I mean, we could do stuff like, hell, I'll go and talk about the West Side to some of these officers and stuff, but a true rigorous training department really requires the funding to support something like that. So that's what I keep hearing over and over and over. We would love to train, but we're kind of restricted. So for me, my question is from this group is then what kind of recommendations, how detailed or right now it just sounds big, but what are the details of those recommendations, at least as we start thinking about them? So it could be a tangible request. Okay, this is what you're asking for, rather than, oh yeah, boy, more would be better. Well, what does that mean? Because I know I have some things in my head, but I sure would like this commission to start bringing those things up so we can start hearing them and start discussing them.
Another gap that I've sensed is the gap about people of color being part of the field training process. And I understand that it's voluntary and so forth, but we need to figure out a way to incentivize the field training officers so that people of color will want to be a part of that as well.
Thank you.
Yeah, because we hear that a lot in other groups, right? Well, we would love to have more minority groups or groups from different cultures, but we open the door and they just don't show up. So for me, that's a marketing thing or whatever. We just have to up it to be able to recruit that group. Chief, I don't know if people have brought this up yet, but if I understand, FTOs are under patrol, not under training.
Yeah, that's correct.
And is there a reason for that? Or I'm just thinking FTO is field training officers, and just wondering why they wouldn't be under training, because then there could be a lot of the more accountability straight through that department.
Yeah, it's just, it's because the FTO is part of patrol. They're actually going out and handling patrol calls. It's always been that way. I'm not saying it should be, but we found it works better that way for the scheduling and the staffing and the things they do. They have meetings and they talk about different recruits and strengths and weaknesses and things like that. And then they decide where maybe a recruit would do better or who they may be assigned to. So it's just always been a patrol function. But it works very close with training, and they do train quite a bit, and they do their own academy. Have you had, I know you've asked for some responses, written responses, but have you had a chance to listen to Lieutenant Ammett and his team talk about the academies that they put on for FTOs? Mason Givens is another Sergeant Givens in that team. Have you talked to them at all?
I don't think I have.
I think I'm just putting something out on the table. Maybe if you want to understand that and how they select FTOs, because it's quite a selection process, and they make them go through an academy. And I think it might be very beneficial for this group maybe to hear that, ask those questions. So again, if you'd like, we could certainly arrange that.
No, that's helpful. That would be helpful too. Thank you.
Thanks.
Any other thoughts from the commissioners? I would love to hear from some folks.
Mine is going to be dispatch. I know that dispatch is not part of the PD, but it is under the umbrella of Salt Lake City, and they're hired by Salt Lake City. And I think that connection is going to help on a lot of those mental health issues, diversity issues, because that call, dispatch is the first place that gets the call, and they should be included in a lot of the training. And then my second one is, I was just reading that report that the captain sent, and they did a training intervention a couple of years ago on sexual assaults. And because the media and the public came down on them. So it's probably an opportunity also before, if we don't have enough budget, that this training intervention could also be put in place as a temporary thing to start going until we can get more money in the budget.
Great, thank you. Commissioner Hawkins, Commissioner Smith.
I've been observing, thinking, contemplating. This is just, we're here because, we're dissecting every avenue. We're looking at every avenue, budget, training, so forth. And also I keep thinking, you know, we're also trying to model for our younger youth. We have our youth on here as well. I'm always about how we support our youth, how we get our youth involved. You know, we have I believe I heard from Sherry about a youth CIT. I mean, we used to grow our own teachers for the American Indian Teacher Training Program, because a number of things that we wanted to look at is eliminating our prison to pipeline. We wanted to support our communities of color, our Native communities of color. And so I can't remember, maybe one of the commissioners or officers mentioned about how are we going to get our BIPOC groups interested in law enforcement. Well, that's where we can look to our youth, you know, and get them interested in looking in this avenue. And then basically we're growing our own, you know, we're getting them involved in the youth CIT programs, getting involved with SROs, which we're also looking at. So I just wanted to just kind of remind that and see, you know, we could look in that avenue as well, because then I think if we get more of our youth BIPOC groups involved, and it really begins that balance in a sense, especially in the Valley where we have different communities. And so, as I mentioned, I'll continue to mention before, you know, like I still have that trigger when I drive down the street and I see a police officer. And today I actually had to take my son to work, and I had a trigger, but my son didn't have a trigger because I did not want to transfer that to him. I didn't want him to have that fear, but it's upsetting, you know, but I want to make sure that here we as commissioners definitely look at every avenue and dissect that. And so I may not say much, but I do have a lot in this brain, you know, in due time it will come out. But this is just an idea and a comment I just wanted to put out there.
Thank you, Commissioner Smith. Your voice is much appreciated, and so I truly appreciate that. Thank you. Okay.
Hey, Dante, may I add a comment real quick?
Yes, please.
Just to kind of touch on what was just said. We have mentioned that we have our Explorer program, right? Which is our youth that are from our community. They range from age 14 to 20. And they are actually our most diverse unit in our department. We have, I think a majority of them are women or female, excuse me, they're not women yet. And a lot of them are people of color. So, you know, we actually have 5 of our former explorers who are in our hiring process right now, in the last stages of the hiring process. And that's who we use to really recruit from. Sergeant Cody Logie, he grew that program. I think, Chief, you can correct me or help me out. I think our numbers are over 30 youth from our community that we have involved in that program, that are learning about the job and want to be part of the job now. I mean, in our school district, we have programs where they can take law enforcement classes, and it is our officers who teach those courses. So Salt Lake City is represented, and they can see that, hey, you have a home to go to if you really want to continue on this path of law enforcement. So we really do try to promote these youth to join our department, because we realize we do need more diversity, you know, as every nation, you know, our law enforcement in the nation does. And I just wanted her to know that we do try with our youth, and that Explore program is very dear to our hearts at the department.
Yeah, just real quick, I know our time's over, but that Explorer program, again, Dante, we have officers that are in charge of that. You may want to talk with them. They have about 60 and at sometimes 70 youth from our community, and it is by far the most diverse unit within the police department. She's right. Most of them are female. The majority are of minority, and like you said, there are 5 candidates that are on our roster to be hired the next go around. And so you would be surprised at the youth from these communities that are stepping up to donate years and years of time to get into law enforcement. So very proud of that group. Good.
I'll give kudos to that group. That they are amazing. They do so much community service out there too. I love that group. Big kudos.
They're a wonderful, wonderful group.
Thank you for that reminder. Thank you. Okay, we're a little over time, but I truly appreciate your time and your energy and your thoughtfulness in doing this work. I really do think we are making progress. Hopefully you feel like we're making progress, you're making progress as we gather all this information to really begin to come up with some concrete recommendations that will be beneficial to the communities, but we also believe they'll be beneficial to the police department. Our goal, I don't think our goal is to do damage to the police department while we're trying to improve the interaction with the communities. We're really, I think, trying to provide the best connection that we can for the best outcomes for all our communities of color. And certainly we can probably make recommendations around budgetary things and training and other components as we dig a little bit deeper into the budget. And I would suggest if you think back to the session I did on equity, I think I had the equity picture there with the fence and that kind of thing. And it's not about, I mean, the budget is finite. And so it's not about getting more money. It's about how do we allocate or reallocate what we have and what we do with those dollars. And so I think that's the real question as we begin to dig into this. Because if we're going to say we need to give the training division, you know, another 10 FTEs and, you know, $100,000 in money, it's got to come from somewhere. So we need to be able to look at the balance of the budget and make a thoughtful recommendation as we do this, certainly as it relates to budget. So just some things to consider as you're reading these next set of documents over the next couple of weeks before we come back. So I'll just let it go from there and say thank you and have a fabulous holiday season and a happy new year. And we will see you in 2021. Take care.
All right.
Take care, everyone.
Thanks, everybody.
Take care.
Todos vida, yeah.